It is often called the invisible disease, but the impact on our mental health is very real. Plus, for women in our community, the road to a diagnosis can take years, even decades longer than it should. On this episode, we are wrapping up our special series with patient advocate Michael Mallinson. We're discussing the critical need for mental health support and why the diagnostic journey is so different and often more difficult for women. This conversation needs to be heard. Stay tuned. Information provided in this podcast should not be considered medical advice. We encourage all listeners to consult their healthcare professionals for medical concerns. Thank you. Welcome back to AS InfoShare. We are here for the final installment of our series with Michael Mallinson, a dedicated advocate who has been sharing his journey and expertise with us. In this episode, we're going deep into the topics that don't always get enough spotlight: the emotional and mental challenges of living with axial spondyloarthritis, and the unique hurdles women face in getting an accurate diagnosis. Before we dive into this important discussion, a quick favor. If you're watching on YouTube, please hit that subscribe button. If you're listening on Apple Podcasts, Spotify, iHeartRadio, or Amazon Music, follow the show so you never miss an episode. You can also connect with our community on Facebook, Instagram, X, TikTok, and Reddit. Be sure to visit asinfoshare.com for deeper dives, community updates, and product recommendations specifically for those of us living with this condition. If you find value in these conversations, consider supporting us at Buy Me a Coffee via the link in the show notes. Your support helps us keep sharing these vital stories. Now, let's get back to the show. This is what I see a lot of people struggling with in the groups, and that's mental health. AxSpA is often called an invisible illness. Many people living with it struggle to have family, friends, and coworkers understand what they're going through. How can patients explain to others what exactly they are going through and what they're feeling and how it's affecting them, how this disease affects them?
It's a very good question, and it's something that's very difficult to deal with. I think dealing with a physical disease and with mental health is really one and the same issue. We know from the IMAS studies that something like 69% of patients with AxSpA suffer from some sort of mental or psychological distress, whether it's anxiety or depression or its attendant lack of sleep or fatigue or what have you. It's a huge thing. And many people don't understand the disease because it is largely invisible these days, especially these days with biologics. I think that's where we come back to educating the general public as well as the patients in the world about this disease and saying, hey, the symptoms of the disease, these are the limitations of the disease, etc. Every patient organization that is a member of ASIF has a website or a Facebook page or something where there are resources that you can download or buy from them that you can give to your caregiver, your friends, your family, etc., that explains what the disease is. And it's very, very difficult when you are so well one day and so down the next day to explain to people how you can't do today what you were doing yesterday. It's mentally wearing. I don't have an easy answer. I think it's just that you have to advocate for yourself and say to your spouse, your significant other, your caregiver, listen, this is what I'm going through. I have this disease. It's, not well controlled, or it is well controlled, but I still have bad days and flare-ups, and this is what you can expect. And here, it's written in here. There are those resources that people can turn to. And I think belonging to a patient support organization or a support group is also important, because there you can vent and you can get other people's ideas about how to deal with the mother who is just not believing that you're actually ill.
So beyond the physical symptoms, what are the most common mental health challenges you see in the patient community?
I've mentioned them: anxiety and depression.
Right.
I mentioned the IMAS study. that looked at these things, and full results of the IMAS study as it is to date you can find on the ASIF website. But the book I'm looking at the moment is the results of the European survey, and in psychological health, if you don't mind me just reading this out, the mental health of participants in the IMAS survey showed that 62% were at risk of psychological distress, assessed using the General Health Quality 12 Index, illustrating the considerable negative effect of AxSpA on psychological health. Co-occurring mental health conditions were common. 50% of participants reported sleep disorders, 39% anxiety, and 34% depression. The risk of psychological distress was significantly higher in female versus male participants, in single or divorced participants compared to those who were married, in younger than in older participants, in individuals with lower compared to higher incomes. And patients who are at risk of psychological distress reported higher disease activity, measured by BASDAI, more severe spinal stiffness, reduced ability to perform daily activities, higher numbers of comorbidities, medical conditions other than AxSpA. And it just means you cannot treat the physical symptoms of AxSpA without treating the patient's mental health as well. I don't know if that really answers the question, but...
Oh, it does. It does. So historically, AxSpA was seen as a man's disease. How has our understanding of gender differences in AxSpA evolved?
It's evolved a long way since I was first diagnosed with ankylosing spondylitis back in 1991. Back then, it was called a men's disease, and I sadly see that many women are still reporting that their healthcare provider says it's a man's disease. It actually is largely true, because what we now know with modern technology is there are phases of the disease. You will know these as non-radiographic AxSpA and as radiographic AxSpA. Radiographic AxSpA is the preferred term these days for ankylosing spondylitis. But in the old days, ankylosing spondylitis could only be diagnosed by positive X-ray images. Guess what? More men than women progressed to radiographic AxSpA. So women were not diagnosed because more of them have non-radiographic. It's also thought that men actually have a faster disease progression for some reason. I would say 10 years ago, when we started adopting the new terminology, Axial Spondyloarthritis, that's the name of the disease, and it has two classifications, which are really used just for research purposes. One is non-radiographic, cannot be detected by X-ray. The other is radiographic, can be detected by X-ray. Non-radiographic means it can't be detected by X-ray, but it can be detected by MRI in particular. And where did the term axial spondyloarthritis come from? It came from the first clinical use of MRI in the 1980s, when people were seeing this sacroiliitis, this inflammation of the sacroiliac joint, and saying, wow, this looks like AnkSpon AS. But it can't be because it's not showing on X-ray. And there was a long discussion between doctors and researchers and stuff as to whether non-radiographic AxSpA and radiographic AxSpA were actually one and the same disease. That argument was decided, 6-10 years ago. It's one and the same disease. But we now know that not all women progress to structural damage, which is visible on X-ray. So that means women are having a harder time being diagnosed, and it means that men have actually in the past been diagnosed more so than women. So it seemed to be a gender tilt, more men than women. But since they decided that AxSpA is this one disease covering both those classifications I mentioned, we had a 1-to-1 ratio. It's as common in men as in women. Now we look at other autoimmune disease, rheumatoid arthritis, for example. More women than men have RA. Guess what? The most recent research into AxSpA is that more women than men have it. It's just that so many of the women are non-radiographic.
So they're not testing positive when they put the test in, but it's there if you did the MRI, which is usually something that they don't go to. It's usually more expensive. It's more of a bigger deal. So they might not get to that point. So,
well, that's right, yeah. If you look at why do women often face a longer diagnostic delay than men, and we know from the IMAS survey that delay is an additional 2 years. There are several reasons for that. One is that clinicians used to think of it as a man's disease and would be dismissive if a woman presented with the same pain and symptoms. They would call it fibromyalgia, which actually is AxSpA. Another reason is that women present with more widespread pain and problems than men. Men, it's really just the spine and the sacroiliac joints, by and large. Women, it's a little more diverse. It seems to be more in the hips and shoulders, even the upper back, than it is in the sacroiliac joints. There is another reason I'm going to bring out this book again, the IMAS results. It says, although there are no obvious gender-based differences in the clinical manifestations of AxSpA, these differences may be due to a later onset of disease in women, the more widespread pain reported by female patients resulting in a delayed diagnosis, or faster disease progression in men. And that's from researchers in 2011 and 2018. I think a lot of the problem is the culture amongst clinicians about AxSpA. They're not very well informed. We were talking about advocacy earlier. I strongly believe it's the patient's role to educate their healthcare provider where necessary.
yes.
So if you're dealing with a healthcare provider who is dismissive of your AxSpA symptoms, take a book, a brochure in, or show them on your phone a website from one of the patient organizations and say, hey, this aligns with what I have, and why, A, aren't you calling the disease by AxSpA, which is its proper name now, and B, recognizing that these symptoms can be different between men and women. Believe it or not, our disease group is actually quite advanced when it comes to gender differences. Other disease groups are way behind us. At least we know there is gender differences, and we acknowledge that.
Right.
And there's a lot of work being done on it nowadays. I'm not saying it's lucky to be alive today with AxSpA, but it's certainly better than
it's better than it's been.
Better than it was, especially if you're a woman.
Right.
Many people, mainly women, don't progress to structural damage, so they can't be seen by X-ray. Men have more structural damage. Women have more widespread pain.
You had mentioned this before about the fibromyalgia. What is it exactly? And what is the differences between that and AxSpA, and what are the similarities?
Gosh, I'm not a medical expert, so I can only offer my opinion of what I know. Fibromyalgia is rather like schizophrenia. It's a catch-all. You know, when they don't know what's wrong with you mentally, they say you've got schizophrenia, or they used to do in the old days. These days, when they don't know what's wrong with you, they say, especially if you're a woman, they say you've got fibromyalgia. So it's a catch-all. They don't actually call it fibromyalgia these days. They call it sensitization syndrome. And it's marked by pain throughout the body which has no obvious cause. You can't see a bone fusing or an inflamed joint or a damaged muscle. The patient just reports that they are in a lot of pain most of the time, and it's very hard to pinpoint exactly where the pain is. So the research into it says that it's in your brain. People don't like to hear this because they say, oh, I'm not crazy, it's not in my brain. It is actually. It's something wrong with your nerve system that is sending signals to your brain saying this little finger is in pain, and those receptors in your brain being overly sensitive to that message. Does that make sense?
Yeah, it does. It kind of goes back to the symptoms are very similar to AxSpA. It might cause doctors to misdiagnose AxSpA more, because then it's like they have this backup, like, oh, it's probably just fibromyalgia. People will go misdiagnose. They won't get the diagnosis and they won't get the treatment for it.
Well, there is no treatment for fibromyalgia except for painkillers. And going to pain management, where there is psychological treatment, where they try to get you into a mindset that the pain you're feeling is not really pain. I did an interview for one of the Spondylitis Association of America's Global Spondyloarthritis Forum seminars, and I was interviewing this pain doctor whose name I can't remember just at the moment. But he was talking that when you start feeling pain, as in fibromyalgia, or any pain actually, and you have these especially sensitive receptors in your brain, you spiral downwards it gets worse and worse and you don't know what to do. But you can hit rock bottom, and instead of staying there, you can turn around with therapy. Some of that therapy is medication, some of it is psychological counseling, but you can get out. You can retrain the brain not to react to all these tiny little feelings that are coming in, which it's reading as severe pain. But in fact, you only touched a pinprick or something, you know, and it's not that your hand is falling off, but that's what it feels like to the brain because the receptors are misreading it.
Some people have a higher tolerance of pain.
Well, yeah, people talk about a higher tolerance for pain, and you know what I'd say? Exercise. Yeah. Exercise reduces pain, it reduces depression, it reduces anxiety, it allows you to sleep better. It allows you to lose weight, which makes you feel better. Everything comes down to diet and exercise. Don't eat junk and exercise.
That's what the doctor says. Food is the best medicine.
So if you go to the asif.info website and look at the IMAS results, it will name the barriers to diagnosis. And NAS has the same thing on its website in the UK. They, I think, have 4 barriers. IMAS has 7, I think it is. But there's clear barriers, you know, starting with dismissal or the GP not listening to you and going on from there. And there's a delay to diagnosis. Even after seeing a rheumatologist the first time, you may not be able to get an MRI for a month or 2.
I know you're in Canada. How long does it take? Because that's the other thing I see a lot of patients complain about is the length of time it takes them to see a rheumatologist. So even if the GP says you need to go see a rheumatologist, it could be 6 months to a year in some places. I don't know how it is in Canada, but I hear people in Australia complain about it, especially when they're not near Sydney. It could take a long time. In India, I had a friend who, we did a podcast with him. He said the same thing. I mean, it takes a long time just to see a rheumatologist. Then once you get the rheumatologist, then getting approved for the medication can take a long time.
It's a global problem. There are not enough rheumatologists. There are not enough rheumatologists who are specialists in AxSpA, and the concentration of rheumatologists is in urban areas. I'm in Ontario, Toronto. I can go a 12-minute drive down to University Health Network and see some of the best experts in the world, the world-renowned rheumatology experts. Wow. I can see them, 12 minutes away from me. But if I drive north from Toronto, I can drive 1,000 miles and still be in Ontario. And in all those small communities up there are no rheumatologists. I know people up in northern Ontario who drive 6 hours to come down to towns, outside Toronto to see a rheumatologist. And on the west coast, in the Queen Charlotte Islands, as they used to be called, the Hayaguayas they're now called, they have to have visiting rheumatologists. Somebody flies in for a few days every few months. The Canadian Rheumatology Association's own guideline is something like 6 months. If you get a referral, you have to see that patient within 6 months. That's far too long. It should be a matter of weeks. Yeah. And I've made my opinion known, and they are working to try and reduce that to a month now.
Yeah, I mean, I'm in New Jersey, just outside of New York City, so it's a little bit easier for me. The hardest part was the initial visit to the rheumatologist. Mm-hmm. So once I was recommended to go to a rheumatologist, it took a long time to get that first appointment. Once you get the first appointment, seeing the rheumatologist got a lot easier. The second hardest thing was the approval for the medication. There was a lot of back and forth and paperwork, but once you get the approval for the medication, then it's not too bad. And that's over here in New Jersey, like I said, just outside of New York City, where it's, you have a lot of doctors. You go somewhere else in the Midwest, it's going to be...
if you're in Wichita, Kansas or something.
It's going to be a lot harder. Well, thank you very much for this. This was excellent. I will post all of those links that you've mentioned into the comment section, and I'd love to chat more later on.
By all means, if I haven't gone totally senile by then.
This was so good. Thank you so much. I appreciate this. And
well, it's lovely to talk to you, and keep up the good work.
You too. Thank you so much. I appreciate that.
Okay.
That was patient advocate Michael Mallinson. If you haven't already, take a listen to our previous episodes with Michael, and be sure to check out his Facebook page, Axial Spondyloarthritis resources. You can also find the link in the description of this podcast episode. If any of our podcast episodes have helped you, or if you think they could help someone else, please give us a thumbs up and share them. Don't forget to subscribe and turn on notifications so you're the first to know when we post our next episode. We'd love to hear your thoughts on this episode's topics. Please leave a comment below. We'll see you next time on AS InfoShare.